Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 40. We're going to talk about the dermatophytes. The dermatophytes are different from the superficial mycoses in that they invade deeper into the epidermis and include some of the accessory structures such as the nails and hair. We'll talk about the clinically relevant subtypes and go through how to diagnose and treat them. Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 40. We're going to talk about the dermatophytes. This first table overviews the diseases known as the dermatophytes. These are fungal infections that extend deeper into the epidermis. They also can invade hair, skin, and nails. The most common dermatophytes include tinea, which you can see tinea capitis on the head, tinea barbae, tinea corporis, tinea cruris, or tinea pedis on the foot. The treatment is usually topical, except for tinea capitis. The most common causative agents are microsporum, trichophyton, and epidermophyton. The symptoms include a ringworm lesion of the scalp, face, body, groin, or feet. You'll often see an allergic, or otherwise known as id reaction, elsewhere in the body as an allergic response to this fungal infection. To identify the organism, you need the presence or absence and the shape of micro and macroconidia. What you'll frequently see with ringworm is skin scrapings which show colorless, branching septate hyphae. The onychomycoses are also caused by trichophyton or epidermophyton, and this is an infection of the nails. And again, you'll need to see the presence or absence and the shape of the micro and macroconidia in order to get a diagnosis. Ectothrix or endothrix are infections of the hair shaft surface. Microsporidium, trichophyton, and epidermophyton are the causative agents again. Same thing with the microscopy, you'll need to see what shape and presence of macro and microconidia. But you can use a Wood's lamp for microsporum. Differentiation between the three fungal species which are most commonly causing the dermatophytes include looking at the skin, tissue, the microconidia, and the macroconidia. And also fluorescence is a good way to distinguish them. For epidermophyton, it will affect the skin and the nails. It does not have microconidia, and so that's something to remember. But it does have sparse macroconidia, and it does not fluoresce. Microsporum is important because it will fluoresce, and you can diagnose it with a Wood's lamp. It has a few microconidia, which are shaped like grapes, and many macroconidia. Trichophyton will infect the hair, the skin, and the nails, and it will do all three. It has many microconidia and few macroconidia, and will not autofluoresce. These target keratinized horny layer of tissue, and they spread in a ring fashion. Let's do a question. A 7-year-old boy presents with scaly patches on his scalp and inflammatory lesions on his skin. A skin scraping revealed hyphae that fluoresced under the Wood's lamp. The most likely pathogen is. So this goes back to the table where we distinguish between the three fungal agents which cause dermatophytes, and the answer is microsporum. That's the only one that fluoresces under the Wood's lamp. The id reaction, as we discussed before, is a dermatophytid or id reaction. It occurs as an allergic response to the dermatophyte infection elsewhere in the body. They do not have fungi in the lesions, but they can be itchy and painful. Here's a picture of some of the dermatophytes. There's tinea corporis as a lesion on the scalp, ectothrix, epidermophyton as the macro and microconidia. There you've got a picture of tinea capitis, onychomycoses or fungal infections of the nails, and the microsporum. Next question. A 16-year-old athlete presents to his physician with several weeks of slowly worsening pruritus of both his feet with an erythematous, dry, scaling lesions that are most obvious in the interdigital web spaces. A potassium hydroxide mount of a scraping of the affected skin will most likely show. So here we have a dermatophytic infection, and we need to look and see what type of items we're going to see in microscopy. As we talked about before, you're going to see branching, colorless septate and hyphae, which is what we're going to see with answer B. Wrapping up Module 40, we talked about the dermatophytes, or superficial skin infections, which involve the adnexal structures, including the nails and hair. We talked about three clinically relevant fungal species, Microsporum, Epidermophyton, and Trichophyton. The table in the slides is good at differentiating the different species. You will be tested on these, and you'll need to know their spore forms, and you'll need to know their id reaction, and you'll need to be able to differentiate them. Up next, we're going to talk about the subcutaneous mycoses in Module 41. Wrapping up Module 40, we talked about the dermatophytes, or superficial skin infections, which involve the adnexal structures, including the nails and hair. We talked about 3 clinically relevant fungal species: Microsporum, Epidermophyton, and Trichophyton. The table in the slides is good at differentiating the different species. You will be tested on these, and you'll need to know their spore forms, and you'll need to know their id reaction, and you'll need to be able to differentiate them. Up next, we're going to talk about the subcutaneous mycoses in Module 41.